For those of you who look forward to Once a Month with Dr. Stephen Grable, today's your lucky day because we're going to be talking about the 10 must-dos to have the best holiday ever. Lots of things happen in life, but if you're prepared, like a girl or Boy Scout or a person scout, then you will have the best holiday ever. So fasten your seatbelt because we're going to learn and grow together. Dr. Stephen, it's time to dance.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here. Right here, and when you need a friend, you can count on me. I'll be right here, waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening friends and my viewing friends on Facebook.com/Lillian's Radio Show. I'm so glad that we can meet each other on the air on this beautiful, best day ever. And if this is your first time tuning in, please know I've been waiting for you. This is a safe place where you can go to when you need a friend. And it is my commitment to provide alternative ways to heal. And it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friends, will feel empowered to embrace a new truth and live the life of your dreams. Now, today, this whole week, it's been about focusing on what we want. We started the week with, focusing on a new healthy you. And then we went on to the new beautiful you. And today we're going to be talking about the must-dos. The must-dos to have a happy, healthy, beautiful new year. There's lots of things that happen along the way. Accidents, hangovers, and so many different things that could make your holidays less than. So Dr. Stephen Grable of Complementary Care Center in Jacksonville Beach, Florida, which, by the way, doesn't matter where you live, you can still reach out to him and he can be your doctor as well. So for those of you who want to learn the top must-dos to have the best holiday season ever, today is the day. And since it is our sole purpose in life to give and receive love and knowledge, I'm grateful that Dr. Stephen Grable is back to do just that. Welcome back to the classroom.
Hey, Lillian.
Yes, we've got lots of teachers' pets waiting to learn from you today. So I want to encourage all of you, if you have any questions, type in a Q and write your question down because Dr. Grable loves answering your questions. He thrives on that. And it's free. So, but if you want to call him, you could call him at 904-247-7455. And that is the Complementary Care Center. So Dr. Grable, so when we talked about, our topic for today, was it easy to come up with must-haves, things that have happened during the holiday seasons that if we are prepared, we can avoid?
Well, I had to think about it a little bit. It didn't just come right off the top. But I thought, like our first one, I thought, what can we do to have the best hangover ever? So that seems to be a common thing. So I did I researched all 10 of these. So I tried to pick out some things I thought would be interesting for the group.
Okay.
And it's interesting. There's been, like with the hangover, there's been really quite a bit of research done on this.
So tell us what you know about, it's not to have a hangover because everybody knows how to have a hangover,
right,
how to avoid a hangover, right?
Exactly.
Okay.
If you get a blood alcohol of 0.08%, then your risk of having a hangover markedly increases. So I don't know how many of our viewers have had hangovers or not. They're not a lot of fun. I have to say before I get into some of the stuff from the literature, I grew up with the eating the hair or biting the hair of the dog that bit you,
Yeah.
that story, And I think there's a little bit of truth to that. I didn't see that in some of the articles and stuff that I read, but, we have alcoholics, coming with DTs in the hospital. We learned over time
What's
that
a DT?
delirium tremens, these are people that are really addicted to alcohol, and if
Okay.
they stop, they have some severe neurologic problems,
Mm-hmm.
and they can actually die from it. It's pretty serious.
Mm.
So they would give them Valium and all different kind of meds. We found that if you just hung an alcohol drip and just turned it down a little bit every few hours over about 3 days, and they were fine.
Wow.
So, people have a hangover. There's a lot of debate about exactly what a hangover is. There's actually 47 different symptoms that have been described with hangover. But when you have one, you kind of know what it is.
Yeah,
the headache and nausea, and you just tired and you just feel really lousy. And I think a lot of it really has to do with some of the acetaldehyde and some of the chemicals from alcohol in your system. So the old eat the hair is to have like a Bloody Mary or like a screwdriver, with orange juice in the morning. And I think, at least for me, back in my drinking days, that seemed to really help to kind of ease the hangover.
So
but
more
obviously,
alcohol helps but isn't that like?
Well, it kind of slows down that withdrawal, because what you're really
Ah.
experiencing is you're experiencing kind of withdrawal from the alcohol that you're drinking.
Interesting.
But there's other things that you can do to try to help to prevent this. Obviously, don't overdrink, but
Sure. But what is the equivalent of 0.08? Do you know what the equivalent of, is it 1 glass of wine or 2 glasses of wine or 10 glasses of wine?
it depends on the body size, but that would be probably 2 to 4 drinks, somewhere in that. Everybody's different. Some people metabolize things real well. I can't, I'll freely admit, when I used to drink, I could drink 5 or 6 and I wouldn't have a hangover, so I think a lot of it depends on your physiology and that sort of thing. But if you drink, they say that you shouldn't drink more than 1 drink every hour or 2.
Yes.
You have to kind of pace yourself with it. Staying hydrated is important. Alcohol tends to function like a diuretic. So we go to the bathroom a lot. And if you wake up really dehydrated in the morning, that can make things worse. So, in between maybe alcoholic drinks, try to drink more water if you can. And that would help. Try to eat a healthy meal. Try not to let yourself get too hungry, hypoglycemic.
So having a full stomach helps slow down the results of the effects of alcohol.
That would slow it down. So they've studied, they found that it's not psychological. Some people think that hangovers are psychological. They're not. They're physiological. They think that there are alterations in neurotransmitters, which are our chemicals in our brain, which regulate mood and nervous system function. They think that there may be some inflammatory factors involved. So, if you're eating, for example, real fatty meal or with a lot of meat in it, that tends to be a bit more inflammatory.
Mm-hmm.
Could potentially predispose you to a little worse hangover.
Really?
Yeah.
I'm proud to say that I haven't really ever had a real hangover. But
you haven't had the pleasure. Oh, okay.
No. But that doesn't mean I haven't gotten sick from. I get sick before I get hungover. My body can't handle too much alcohol, and it says, "Okay, it's going out right now." Boom, and it's ask my husband. So so I learned I don't. There's certain things I just don't like, and that I don't like. I don't like throwing up, and so one thing I learned when I do drink alcohol, is I have 1 glass of alcohol and 1 glass of water. Mm-hmm. And I alternate every other one. So if somebody says, "Hey, would you like another glass of wine?" Time to hydrate.
Right. Good. That's, and that brings up, something, alcoholic poisoning. Ooh. Is something that people need to be aware of, because, I think we would know if someone was having seizures or they weren't breathing or they, where he had blue skin or something like that, we'd know that there was something dramatically wrong. But, even things like somebody not being able to waken them, you don't want to say, oh, well, they're just drunk,
Mhm.
So I think recognizing that if you've watched somebody and if they're really drinking and overdoing it, that, that's actually a 911 emergency, 911 emergency. So, because they're confusion, vomiting, seizures, slow breathing, that kind of stuff. So that happens.
That can ruin your year.
That can ruin your year. Yes.
So are there any, you said a Bloody Mary or a screwdriver can help the hair of the dog, but is there anything out there? Like people used to drink Alka-Seltzer, like my friends would drink Alka-Seltzer.
Right.
That would make me throw up right there.
Yeah.
But is there anything that we could take to prevent the hangover or make the hangover go smoothly?
So you wake up in the morning and you say, oh my God, I got a hangover. So you'd want to rehydrate, because generally you're not hydrated well. If you can stomach it, a healthy meal with protein and complex carbs. You want to replenish your electrolytes. So you could use something like kefir as people pronounce it. Coconut water is really good. That's high in minerals and so forth.
Yep.
Fresh watermelon. There's a lot of Saturdays I'll just eat half a watermelon, and it's yummy and refreshing, and that would be well tolerated.
Can you find watermelon in the holidays?
Well, I get them, Costco and Publix.
They still have them out there. Okay, grab a watermelon.
But
yep,
you can get it. And
okay,
obviously, it's nice to have a cold, so have it in the fridge. You want to stay away from Tylenol. This is one of the things that people use a lot of Tylenol, and that's a little hard on your liver. And what it does is it gobbles up glutathione, which is one of your main detoxifying antioxidant chemicals. So some other things, I got a little list here. Magnesium is helpful. And I would just use a non-oxide form. So you can use like a magnesium glycinate. Magnesium threonate has been touted to be real good for the brain and nervous system.
Threonate. How many magnesiums are there?
You got citrate. The oxide, that's the old cheapo one. I use that for constipation. But yeah, there's 5 or 6 different formulations you can get in different magnesium chelates. See, magnesium has to be bound to another compound. So they'll bind it to glycine or to citrate, things like that. So coconut water is really good. We were just kind of talking about that a little bit. Mm-hmm. Ginger tea, ginger is a good anti-inflammatory. So keeping some ginger around. Eggs can be helpful. It's a good source of protein. Vitamin B6. If you take B6, I suggest using a form called P5P, which is the activated form of B6. 50 milligrams of that would be good.
Okay.
Bone broth is another one.
Nice.
Milk thistle. A lot of people have heard about that. It's good for the liver. And Siberian ginseng. So the magnesium, coconut water, ginger tea, eggs, complex carbs, P5P, bone broth, milk thistle, Siberian ginseng. These are all things that can kind of help get you through this.
Okay, so if you have a hangover this holiday season, you can only blame yourself because you've been warned by Dr. Grable. Okay, so do you have anything else that you would like to add about that, or are you ready to move on to number 2?
Well, let's go on to travel safety.
Travel safety. Love that one. Let's talk about what is it that we need to look for.
Well, this is, it's interesting. You read some of this stuff, it kind of cracks me up. They talk about, if you've had any kind of recent surgery, you should talk to your doctor about travel, especially stomach, brain, eye, orthopedic. So I think it kind of reminds me of those shows where it's 20 below zero and they tell you to be sure to wear a coat when you go outside.
Uh-huh.
It's like, duh. So
you said stomach, brain?
Yeah, basically, if you had any kind of major operation, obviously you'd want to talk to your doctor before you travel. Before you travel.
Okay.
Talk about, recent heart attack or stroke. And a lot of these have to do with plane flights because you're at reduced oxygen tension when you're up in a plane. Mm. So anything where, if your brain or heart has been compromised, you don't want to be in low oxygen. So I think some of the ones, and a lot of these are common sense. Like they talk about uncontrolled psychotic illness. I don't know who's going to fly with uncontrolled psychotic illness, But anything like, fever over 100.4, probably ought to think twice.
Oh yeah, you shouldn't travel when you're sick because you're
Right.
going to be confounded in a box for I don't know how many hours, and the air is circulating,
Right.
so everybody's going to be sick in that plane. So I would say be courteous and get insurance when you travel. That way you can cancel it and not get everybody else sick. That's how epidemics start.
I tell my patients, you're basically kissing everybody on the plane. You like that thought, right?
Yes.
So what I do, one of the things that's a great tip is I love Argentyn 23. Now this, you can only get that from practitioners, but the Sovereign Silver, you can get that at your health food store. That's made by the same company.
Mm-hmm.
These are silver hydrosols, they're not colloidal silver. And so what I'll do is when I fly is I'll just do a couple of sprays in each nostril every hour. And it's really important to keep your hands washed. They've done studies where they will, for 3 hours, they say, okay, we're going to do a study. We're going to spray this stuff on your hands. Don't touch your face. And so the 3 hours will go by and they'll say to the examinee, did you touch your face? Oh, no, never touched my face. And they'll put a black light up and their face is just covered. Because we're constantly, rubbing our noses and touching our, so, viruses and things can stay on surfaces for days. So you think of all the things you're touching and all the people that have touched. So your hands are really fantastic. So if you can just do your best, wash your hands frequently, keep them away from your face. That's a big one.
Yes. And so would it be advisable when you sit down in your chair to get a wipey and wipe things down?
That's an excellent idea. Yes.
Okay.
Yes.
Anything else? Any other tips for that one?
Well, there's, the CDC has charts about vaccinations and things depending on where you travel to. As we've talked about before, I'm not real big on that subject. But, probably if you were going to, say, rural China, it might be a good idea to have yellow fever vaccine, something like that. I think that the risk-benefit ratio would be good. But a lot of those things, I think, are somewhat unnecessary.
Mm-hmm. And you have to have it when you travel like that overseas?
I don't think they're mandatory. I think these are just recommendations that are made.
Okay.
Like if you're going to some place where malaria is endemic, there are non-vaccine medicines you can take, like chloroquine, things like that can help protect you.
Very good. Yeah, very smart.
How too many people are traveling those distances, but FYI.
Yeah, that is probably the worst part, like when you travel, having to sit there and you're breathing everybody's air. But again, a positive attitude will have, like, if you think you're going to get sick, you're going to get sick. But if you say, no, germs don't land on me, germs land on the person right next to me. I've been lucky that way.
We're all carrying a lot of this stuff. The healthiest people on the planet are pediatricians. Because, these guys and gals are getting inoculated all day long. So their immune systems are just revved to take on stuff. So the real key, like anybody comes sick in my office, I'm always interested in why they got sick. Because, usually you can figure out that they've been unduly stressed or, not getting enough rest. So I think that a lot of this stuff in terms of not getting sick starts even before you step on the plane. Mm-hmm. Just not everybody, it's always a stressful time because you're trying to pack and do all that stuff.
Yes. A new mantra. This is my mantra. This is something that I've said all along is I am healthy, I am wealthy, I am wise, I am love. Just keep promoting that healthy attitude. I am healthy, because the moment you think you're going to get sick, you will, right, Dr. Grable?
Right. Exactly.
Yeah. Okay. So anything else about that?
I think that's good.
Okay. Now, what's your next tip?
Well, it kind of ties in with this. I thought we'd touch on, flu and colds.
Okay.
Because that seems to be a common thing.
Okay.
So one of the homeopathic remedy I like is oscillococcinum.
Oh, is that a Harry Potter spell?
I took a special course to be able to pronounce that.
Okay, can you pronounce it again?
It's oscillococcinum. I think you guys have probably seen it at the store. It comes in I think in a white and yellow box and has these little containers with little pellets in. And it's a homeopathic. And if you get that within the first 24 hours of a cold or flu, it usually knocks it out.
Get out, really?
Oh, yeah. I had this, I'll never forget, I was on a trip years ago, and it was 3 or 4 in the afternoon, and it was one of those, I could tell that I was coming down with something. You start to feel that achy and tired and all that stuff. So I got some, and I took, what you're supposed to do is take 3 doses in a 24-hour period. And I took 2 doses that night, and now this is just an anecdote, but by the next morning I was fine. And I knew normally that I would have come down sick with this. So I found this to be pretty healthy.
How do you spell that?
It's OSCILLO, coccinum, COCCINUM, oscillococcinum.
And
You
so,
gotta change the name.
yes. So that is something that you can find
CVS.
over the counter.
Right.
And
that'd be great to keep around. And the minute, you can kind of tell, usually about a day before you come down with a sickness, you kind of get a sense.
mm-hmm.
You'll run down, you just, you feel kind of achy, maybe a little chilled. Your body is giving you signals. So that's when you want to take either that or like that airborne. A lot of people are familiar with that one.
Yeah, but the airborne, isn't that doesn't it have 1,000 milligrams of vitamin C and a bunch of other
I've not
things?
used it. I know that it's a homeopathic, at least it has some homeopathic in it, and it's touted to be great for it. I usually use the Oscillo. That's what I like.
So that's the do it yourself.
Right. And then again, like we talked about on the plane, the Argentin 23 nose spray,
Mm-hmm.
really good. So I'll do is have you do a couple sprays in each nostril every hour or so. And if you're not better in 24 to 48 hours tops, then I have you nebulize it.
Oh.
So I'd encourage everybody to get a nebulizer. Your doctor have to prescribe it for you.
And nebulized silver?
You can nebulize the Argentin quite safely. Yeah.
Wow.
So I'll put, I don't know if you ever used a nebulizer, Lily?
I grew up with chronic asthma.
Oh, okay. So you know exactly. So, there's like a little well that you can put the medicine in. I usually just kind of eyeball it and you put the top on. It's real simple. It has a little tube, goes to your machine, and you hit a button and it vaporizes.
Yeah.
And I just have you breathe it into your nose and in through your mouth, and you want to get it down in your lungs and, all over your sinuses and stuff. I mean, it's amazing.
Can you put it in your, diffuser? Can you put it in your diffuser?
That's a good question. I don't know why you couldn't. The only thing that Seth Quinto, he's the big rep with the company, he says you don't want to mix it with anything. So I even have my patients have separate tubing for the Argentin. So you want it just by itself.
Okay.
But I had a little boy with cystic fibrosis. His mother brought him in, and she was kind of desperate. And I told her, I said, well, I'd never tried this, but I told her about nebulized Argentin. So I said, well, let me know what happens. So she calls me up a few weeks later and says, well, I'm not having to take Johnny to the ER nearly as much.
Wow.
And they got those horrible Pseudomonas infections. So, and then another great thing.
I love Argentin and also Sovereign Silver.
It's the same company. Yeah. Sovereign is 10 parts per million. Argentin is 23, but they both work.
Yeah.
And then zinc sulfate, that form. So you can get that in a lozenge or drops. And you want that to get in the back of your throat and get on your tonsils. And that stuff will kill viruses, and that'll help you to get better quicker. And
garlic, sucking on garlic is
Garlic is a good antiviral. I mean, there's a whole slew of different antivirals that people can take.
And the side effect of sucking on garlic is the vampires stay away.
Exactly.
Yes.
So lysine, amino acid, 500 to 1,000 twice a day. That's really good. And a little tip, whenever you're taking an amino acid, always take it away from other protein, because you don't want the protein competing with the absorption of the.
So no amino acid.
So no other amino acids with, like lysine's amino acids. So if you're taking that, Either take it on an empty stomach or with some carbohydrate. But you wouldn't want to take it like in the middle of, say, a meat meal or something like that.
Okay. So you can have it with carbs.
With carbs, that'd be fine. Yeah.
But okay. So there's a difference between a cold and the flu. And I remember one year everybody was getting the flu and someone had said, oh, you can have the Tamiflu, and the Tamiflu would be something that'll help you. I at the time, I was not in the same mindset that I am today. So, but I still don't like a lot of medication, always been that way.
Right.
And so I bought the Tamiflu, spent $80 on it, and we never used it.
Yeah, you can tell that a common cold, you're going to have a lot of sinus stuff, runny nose, sore throat, swollen lymph nodes, fever, that kind of thing. The influenza, which is technically the flu, you typically have a very dry cough, somewhat of an absence of sinus stuff. You usually have a fairly high fever, headache, very achy. So those are some discriminating things. So if you have, usually with most of us get like adenoviruses, which is common cold stuff.
Mm-hmm.
And, but yeah, these principles work fine for influenza, just like they do for common colds. And we do, vitamin C IVs. So that's another thing that, somebody come in, we'll give them a 25-gram C drip.
25 gram?
Right.
Okay. That's great. 25 gram, because you absorb, when you have an IV, don't you absorb the majority of it?
It's 100%. Right.
100% absorption. And when you take a pill, like a vitamin C pill, how much do you absorb there?
It depends on the formulation. Some of the newer liposomal Cs are absorbed quite a bit better, but nothing compares to IV. But it's interesting, your body, they've done studies in animals where when you're sick, your ability to absorb vitamin C goes up. Mm-hmm. So usually the limiting factor is diarrhea. So you might find that at 5 or 6 grams of C a day, you might get loose bowels. But when you're really sick with, say, a bad pneumonia, you might be able to take 50 to 100 grams orally.
Yeah.
Because your body is really wanting to take it in.
Well, what people don't understand is that animals like dogs, they produce their own vitamin C when they get sick. We as humans do not produce vitamin C. That's why we need the vitamin C.
Well, animals, you're exactly right. Animals produce their own vitamin C. The only species that doesn't are primates, guinea pigs, fruit-eating bats, and humans. And besides humans...
Not the humpback whale?
Guess the humpback, I've never heard that. Do they not make their own vitamin C?
I don't know.
Okay.
I know that a humpback whale might need just as much vitamin C as a guinea pig. That's how our bodies work. You just, depending on what you need.
Yeah. But all those other animals are eating fruit, see?
Ah.
They're getting tons of vitamin C, so.
Got it. Okay, so what about Tamiflu or anything like that? If you do have the flu, what's the best thing to do?
I think nebulizing the Argetin, hands down.
Okay.
And then take vitamin C to bowel tolerance. Take it every 3 hours and just keep going up on the dose till you start getting a little loose bowel, then just back down a little bit.
That's it. That's your sign.
Like I said, you could probably tolerate 20, 30 grams a day if you're sick.
Yeah, I took when I was trying to fight it, 65,000 just every so hour. Yeah. Because I would take them 5,000 at a time, and after that, by the time the end of the day, I was done. I knew I was done. I had reached my goal.
Your listeners might be interested. There's a couple of authors, Dr. Klenner, Klenner, and Dr. Cathcart, Cathcart. Now, both these guys have passed on, but they would use phenomenal doses of vitamin C. I mean, just amazing. And the reports they had were just unbelievable.
Yeah.
So C is really a remarkable vitamin.
Well, I don't know if I shared this with you, but when I was born with chronic asthma or by 9 months. That was the first time I was hospitalized. But I was on asthma medication, and they put me on this medication that was like a shot that I would take. It's Xolair, which after 9 years, my body said, no, you can't do this anymore. But Dr. Andrew Saul of Food Matters, during a break for the radio show, said, I can get you off all your medication, Lily. And I said, well, bring it. I'm ready. Because this is like when I started learning about holistic alternative, and I wanted to get off of the medication. And
Yeah.
he said, take enough vitamin C to be symptom free, or bowel tolerance, whatever the case might be. And that I started doing, I got rid of all the medication. So that's what I do for vitamin C. And
C is a
lobelia.
good,
Lobelia is really good for asthma too.
Lobelia is very good. Vitamin C is an antihistamine.
Mm-hmm. And an
So,
anti-inflammatory.
right. So that makes sense in terms of asthma, allergy, that kind of thing.
Yeah. But lobelia with vitamin C, I've dropped down the amount of vitamin C that I've been taking because of lobelia, which is really good. So yes. Anything else that you can tell us about that kind of cold flu?
Those are some basics. We could talk about that for a lot longer. But I figured that you might want to get on to dealing with difficult family.
Okay,
let's do that. Topic.
That is always fun. Woohoo!
Woohoo!
How do you deal with difficult family? We're going to be talking about that with Jason Stevenson next week too.
Oh, really? Okay. Yeah, you immediately
may want to tune in.
Politics. Yeah. So some of these things tend to be a little bit of common sense, but they're, one of the things we do, with family, we always try to fix people.
Yeah.
And that just doesn't work. So, one of the tips, because I was researching this a little bit, is they talk about, we all have that difficult person in our family, is just let them express themselves. And I found that it's kind of interesting. If you, I've played with this, I've experimented with this. If you're on a topic that's a little bit contentious, and you just be quiet and you just actively listen, usually after a few minutes, most people kind of run out of steam. And, you can just nod and so forth. And talk about watching, stay away from those trigger topics. We all kind of know those things. Let them state their position, don't interrupt them, because, we don't know, it's the old saying, like in Indian, about walking a mile in another man's moccasins. You really don't know what someone's going through, so you can't kind of jump to conclusions.
If you take them on, it makes the matters worse. And so if you were like, I love how you're saying, just nod your head, acknowledge, listen, and then change the subject. Right?
What's
change
that?
the subject. Change the subject.
Change the subject, yeah.
Yes. Did you like those shoes? Did you see there's a sale at Dillard's?
Exactly.
Yeah. I had to learn that the hard way. Because, in our family, we have the I'm right bug.
Yeah.
We got bitten by the I'm right. And it's taken me, it's taken me time to get over that. And that was something that I realized, that virus is I'm right virus. And so now I can listen to a difference of opinion and I don't have to correct it or take them on.
Uh-huh.
Letting somebody emote or whatever. But what if they're abusive though?
Well, and this is another thing too, that your own well-being comes first. So you should not be expected to sit there and take it from somebody. But I think in that setting, we all can, if you kind of sense that things are going really south, you can excuse yourself, go to the bathroom. I mean, there's lots of different ways to kind of get off. I always tell people that, if they're on the phone with that mother-in-law or somebody who they're having trouble with, say, oh, gee, I got something on the stove. I'll catch you later. Break that. And
exit stage left. Yeah.
There's we had talked about that book. Did you ever read The Four Agreements?
Yes. And I told you that.
Encourage people that it really touches on this to be impeccable. The Four Agreements are: be impeccable with your word, always do your best.
Yep. Don't
make assumptions, which really that's kind of judgment.
Yeah.
And don't take anything personally, because it's really amazing. That's one thing I talked about. It's usually not about you. We always tend to think somebody said something, we make it about us, and usually that's not the case.
Yeah, and sometimes you just gotta love people from afar, and if somebody is rude or anything like that, maybe a nice little conversation beforehand saying, last year, that topic that you brought up was not a good topic to bring up. Let's try to keep it loving and that'll start an argument right there. Yeah. But sometimes you wonder, why do people come to family functions if they just want to fight with everybody?
Yeah, exactly. So I suggest you wear your MAGA hat to the next family function.
Leave your dukes at the door.
Leave your dukes at the door. There you go.
Okay, what else do you have to say about?
All right, so
number 5.
Jet lag. All right, so we all kind of know what jet lag is. We've all experienced it, but there's a couple little points that I thought the listeners might find interesting. There are these rhythmic cues in our environment, and they're called the Zeitgeibers. Probably some German figured this one out. And these help us to kind of synchronize our internal clock. Mm-hmm. And that includes light. We obviously know when it's daytime and dark. Temperature, it tends to be usually warmer during the day. Meal timing, we're used to kind of breakfast, lunch, dinner. Social interactions, at nighttime, obviously that tends to slow down. Exercise, and even the effects of medication. So these all kind of play into our circadian rhythm clock that we have, mm-hmm. which is regulated by our hypothalamus, which is a big hormone regulator in our brain. So most of the time, this affects us when we go on plane trips. So one tip that I thought was pretty cool was if you are traveling east, what you do is you start a few days before your trip, and you begin practicing your PM routine earlier than normal. Mm-hmm. Like if you normally go to bed at, say, 9 o'clock, that you would, move it back to 8:30 and then 8 and 7:30 and 7, etc. So
you start gradually mimicking that pattern of where you're going.
So that when you get to that place, because the jet lag can actually go on for several days. And, if you're going someplace for a week, you hate to have 3/4 of your trip being miserable. And likewise, if you're heading west, move things back. So stay up later and later and later to adjust. Bright light therapy in the morning can help. That can help you kind of get going with if you're experiencing jet lag.
What about staying up? What about, when I flew to France, I was literally up for 27 hours because the flight, I didn't sleep. I landed in France and I stayed up until it was time to go to bed the following day. Yeah,
and I'll bet I imagine you were pretty adjusted then.
I did. It was cold turkey for me.
Yeah. So I'm taking my boy to Italy in the spring, so we're going to have to plan ahead there. 6 or 7 hour change. Melatonin is very helpful. That can help to get us kind of regulated with our sleep. If mm-hmm. you get someplace and you can't get to sleep, that's pretty helpful. Caffeine in the morning can help. I know there's a lot of negative stuff talked about with coffee and caffeine, but I had a journal article from Townsend Letter, a 2 or 3 page article on the benefits of coffee. Mm-hmm. So it just kind of depends on your temperament and your body habitus, if you will.
Yeah, 1 cup is not going to kill you, right?
No. A cup or 2 is fine. So that's, and then exercise can kind of help you adjust as well. I didn't really research this, but if you want to write this down, there's this Argonne, ARGONNE, anti-jet lag diet, which involves fasting before a scheduled travel. So supposedly that also has some benefit.
Oh, interesting. I'll have to check that out. Very good. Because, we're traveling and we go on trips. So maybe that's a gift that you're going to get for Christmas. And you want to be able to be prepared for this jet lag. Okay, so what's next on your plate?
Okay, so next is choking.
Yikes.
There you go, yikes.
Yeah.
So this was interesting because
did we lose him?
Up until 1972, it was generally recommended to give people a good crack on the back if they started choking on something. And what they found is that if you had, say, a piece of meat or something like that that was partially lodged in the throat, if you do that, you could actually cause it to actually go down further and cause more problems. So this is one of these things that it doesn't lend itself too well to just audio, but if someone is choking, there's kind of a universal choking sign where people, put their hands around their neck.
Yes.
If they're obviously passed out, you have them lay down on the floor and you sit on their legs. You put one hand over the other with the kind of the heel of your hand. Mm-hmm. You put it between the belly button.
Show a little higher. Show a little higher.
You do it like this, between the belly button and the breastbone.
Okay.
You push down and up. And what that does is it effectively is like a cough.
Oh.
And so you do that as much as you need to. In the articles I read, they didn't mention the finger swipe, but sometimes people have stuff in their mouth. You might even be able to swipe it out. Mm-hmm. Most of the time, like let's say you're at a restaurant. It actually happened to my sister, and someone was choking, and she had the wherewithal that she got behind them. And I thought this was kind of cool.
You want to stand up? Do you want to stand up a little and show?
Okay, I can just show you here. So if you put this part of your hand right at the belly button.
Okay.
You see me?
Yes.
And roll up. That's about the perfect spot to push in like this.
Okay.
So pretend that I'm standing behind me doing this.
Okay. Got
it. And you have to be kind of forceful. Now, the only thing you want to be aware of is if you notice in your breastbone, there's a little knot, a little piece of cartilage down here. Yeah. You do not want to push that. Okay. Because that can actually break off and lacerate your heart. It's interesting.
Whoa.
So that's why, I was always taught when, in ACLS, go a couple of finger breadths below the xiphoid process, which is this little bump here.
Yeah, I thought that's what it was called.
But if you do the thing, it's interesting. Like I said, if you start with the hand and come up, and then that just positions you just about perfect.
To the belly button, and then you roll up.
Yeah. So what you do is you push in and up. You want to kind of, you're trying to push up on the diaphragm to create pressure to pop out the object, and they can literally, the stuff can literally go flying across the room.
Wow.
That much force. Yeah, this was discovered by Dr. Heimlich. This guy was a Cincinnati surgeon, and he had developed various gastric tubes for esophageal replacement and so forth. And he was just kind of troubled about there wasn't much being done in terms of people choking. Because supposedly there was like 3,000 people dying a year from choking. So he developed this, and of course they named it after him. And now it's been shown to be very good.
Life-saving. But the key thing here is chew your food. Chew your food. Right. Chew it well. A lot of people are chewing, they're talking, they're laughing, they're drinking, and they forget that they need to chew their food. And so, but in the situation that you get, that's a great tip, because you just never know. You get caught off guard and you start relying on the patting on the back, and the reality that could make things worse. So thanks for that. So yes. Anything else that you want to add for that?
Just one thing about the kids, small ones.
Okay.
So what you do with them is you have them lay down on your arm. You'll have your arm on if you can picture this, on your thigh.
Okay.
The baby is face down, but you're supporting their head, but you want to be careful that your hand isn't covering their mouth and nose.
Yeah.
And you give them firm cracks with so it's kind of the opposite we were just talking about. But see, they're upside down and they're kind of held down at an angle. And then you give them blows like that to help.
Like you pat them in the back?
On their back. If that doesn't do it, you can flip them over, do a finger sweep, make sure there's nothing in their mouth, and then actually push on the breastbone about an inch down between the nipples and that force can cause it to pop out if they have.
So you said between the nipples, an inch down.
So no, an inch in. In other words, you want to push down
Between
about
the
that
nipples,
far.
an inch in.
You're pushing pretty.
Whoa, I did not
Yeah.
know that. Okay.
Yeah, I mean, obviously you don't want to hurt an infant, but if they're choking to death, 911 may not be able to get there in time. So you want to be able to do enough that you can get that.
I'm getting. I just the thought of it just.
I know it's anxiety producing.
Moving along with frostbite.
Moving along. Okay.
No, is there anything seriously? Because that is a serious topic. Choking is a serious topic, especially with children who might decide that they want to eat their Lego.
Right.
So
I suggest the listeners go to YouTube. You can find all kinds of videos and so forth.
Okay, perfect. But be prepared. Learn how to do it so you're not caught off guard. Perfect.
Yeah, that's the key.
Number 7.
Frostbite, we don't have to worry about that too much down here. I was raised in Buffalo, so I was used to frost nip, which is like the first stage. And we'd be out playing till you couldn't really feel your hands and come in and thaw out. There's 4 stages. Well, you have normal, then you have what's called frost nip. It's where like your fingers might get a little reddened. They might feel like a little numbish and tingly. They're kind of a prickly feeling. They might even get a little white bluish. That is not serious. That will, you can come in and just warm up and you'll be fine. Superficial frostbite, that's when the skin starts to turn a little white or pale. And actually a warning sign is your skin may actually start to feel warm.
Okay.
There might
is it that people go out in the cold without being ready for it?
Well, yeah. I mean, you want to be prepared, especially if you're sitting somewhere for a long period of time, something like that. But definitely, where lots of layers, that tends to hold air well. My people tend to panic. My brother-in-law was an avid hunter, and they used to call him into the Adirondacks to rescue people who had gotten lost. And it's really interesting because these people would start taking their clothes off. Mm-hmm. And you'd find them just sometimes stripped down to their skivvies, and it'd be, 10 degrees out kind of stuff.
Wow.
So, the big thing is knowing the difference between sort of frost nip and then getting over to that frost bite. At that level, then you definitely want to get into ER or acute care place. The signs and symptoms of superficial deep frostbite would be increased pain, swelling, fever. You'd really get a sense, that something was really wrong,
But if you're in a situation with frostbite or you start seeing these signs, are you saying that most people don't have the wherewithal of going into a house and warming up, or do people not realize that this is happening?
But people, sometimes people will ignore things and they'll just, depending on what their activity is. Part of the problem is if somebody's been drinking a lot, they may not be particularly aware of things. There are, drinking too much, people, any kind of,
have your designated driver.
They're
looking at you.
Because sometimes there's medical conditions where they don't really respond to the cold, if like they're dehydrated, sweating a lot, diabetes, poor blood flow, stuff like that.
They may not become aware. Yeah.
That can be a factor. So
Got it. Okay. So get inside, seek shelter if that situation happens, obviously, right? Obviously. Okay.
One other thing, wear mittens rather than gloves. I think that's a good point.
Mittens rather than gloves?
Because your fingers are together and you'll actually stay a bit warmer than wearing gloves.
Okay. Anything else?
Yeah.
To avoid frostbite?
Beg pardon?
Is there anything else that we can do? Like mittens versus gloves is something I wouldn't even think of. I'm a Florida girl.
You have your ears fully covered.
Ears covered.
You tend to get, your nose, ears, fingertips. Those are the areas that tend to get more frostbitten than others.
Okay. So we're coming down to almost the end. I want to say, I want to encourage you to go to, if you want to listen to this over and over, share it with a friend. Go to whenyouneedafriend.com, subscribe, check out all my sponsors. Like Dr. Stephen Grable, we talk about him every day in the classroom, who's taken a stand to bring this kind of information to empower us, as well as Liberty Health Share, Keep Me Safe Organics Beauty Products, First Alternative Care. We have the pharmacy in Merritt Island, Live Longer Medical, and Dr. Grable just met Lisa at Live Longer Medical. They were both there learning outside the box as well. And of course, Ground Therapy. I want to encourage all of you to give the gift of health for the holidays, and you can become an enrolled student. So check out the website, whenyouneedafriend.com, subscribe, check out my social media, subscribe, like, follow, invite your friends, because we want to grow, because this information is so powerful. So Dr. Grable, now we are going into the last several ones, and we are almost out of time here. So what would you say are your top, what is the next thing that we need to be aware of for a Happy New Year?
I think talking about the intuitive eating.
Okay.
Because, everyone, after the first of the year, they have all these New Year's resolutions. And when I started researching this a little bit, I was rather surprised to learn that 90 to 95% of all diets fail.
Yes.
And I think it's because we go on a diet and then we come off a diet. And the problem is that if you go on a diet, and let's say you drop 20 pounds, if you drop that weight quickly, you're going to lose muscle and fat, but you're going to gain back fat. So each time you do this yo-yo thing and you cycle, you're going to be replacing muscle with fat, which is much less metabolically active and more difficult to try to get rid of. So this intuitive eating, it's really a lot of common sense. But the bottom line with it is, first of all, try to give up this idea that certain foods are really terrible and you can never have them. So if you want to have a piece of chocolate cake now and then, that's perfectly fine. I think I use this little analogy with my patients. So, if you go to the refrigerator and you open it up and you stand there going, what do I want?
You're not hungry.
You're not hungry. Okay. Drink a glass of water, go for a walk. 2-3 hours will go by and you'll have never missed it.
Yeah.
But if you stand there exercising discipline, you're probably going to lose. So just get away from the stimulus. On the other hand, if you open the door and you have this empty feeling in your gut and you see an apple and you say, that will fill this emptiness in that's hunger. So eat slowly, chew your food. And as the Chinese say, eat to 80% full. And if you do that, what's going to happen is the weight's going to start coming off, because I've been in practice 30 years, and it is rare that someone who's got a weight problem, that they're not either comfort eating or they're really eating by the clock. They're not eating really when they're hungry.
Yeah. So
if you can find substitutes for that, and that could be probably a whole show in and of itself.
Well, yeah,
but I would
absolutely.
just encourage the viewers not to go into any of these crazy diets and so forth, but rather just, it's more like this mindful eating, as they call it.
Yes. Absolutely.
So just, make peace with your food, respect your fullness. We all know when we've had enough.
Yes. Yes. And Dr. Grable, I want to go over the last couple of after we finish the podcast. So everybody who's listening on the podcast, you're welcome to join us at facebook.com/Lillian's radio show, or you can also go to the YouTube channel as well. You can find that at whenyouneedafriend.com. But I want to encourage all of you, if you have any questions for Dr. Grable, his email is drsgrable@gmail.com. And he responds to everything that he gets. Also, you can go to his website at drgrable.com. I want to encourage you that if you want a doctor who's going to treat the root cause, spirit, mind, and body, this is probably the place where you want to go. And if you're in Jacksonville area or in the North Florida area, or worth the drive even for anybody that's in the area, make a field trip, go see Dr. Grable. He's in Jacksonville Beach. You can find him at drgrable.com. You can call 904-247-7455. We're going to continue our conversation after the podcast. But Dr. Grable, thank you so much. You're wonderful. I absolutely adore you. And I want to wish you a happy and merry holiday season.
Thank you, Lily.
Thank you. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Stephen Grable wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
I heard the man say, we need to take responsibility for what we do for ourselves. I love, Dr. Grable, how you were talking about intuitive eating and, how it is important that we eat when we're hungry, right? So right. I just recently had a doctor say, we either eat out of habit or we eat out of hunger. And there are two it's very distinct. We're either, because sometimes I eat and I'm not really hungry. I'm just eating because I'm eating. But after a 5-day fast and not eating for 5 days, it's like most of us aren't really hungry.
Right.
We're just toxic.
Right. Right. And, and there's another factor too. I mean, the food scientists have gotten very clever with food. And because if you look at, for example, bears, if bears are eating natural bear food, they're nice and trim and muscular. They start eating people food and they blow up like balloons. Yep. So, a lot of the sugar and fat and salt and additives and MSG and all these kind of stimulate our eating center to want to eat more. So that's why if you're eating more whole food, it's going to be easier to maintain.
Absolutely.
The old Lay's potato chip, you can't eat just one, so I mean, it's just.
And the 90-10 rule, 80-20 rule, if you are going to have this once in a while, that may not be so bad, but if you're going to have it all the time, now that's bad.
Yeah. I read an entire book on binge eating. So I thought, well, this ought to be interesting. So
what did you learn?
The mistake that people make is, let's say you got this half gallon of ice cream in the freezer and you stick your spoon in, you take a scoop and, oh, this tastes so good. Oh, I shouldn't eat that. And then you have another one. Oh, I really shouldn't eat that. Well, before then you feel shamed, you feel guilt. Well, now you feel even worse. So you wind up eating more ice cream to try to assuage, to make you feel better for the guilt. Before you know, you've eaten half a gallon of ice cream. And now you're in the tears and oh my God. So what they suggest is fill your freezer up with ice cream. If you feel like you got to have some ice cream, fill a big bowl up with ice cream and give yourself permission to eat it. Mm-hmm. You'll take 2 or 3 bites and go, I can't eat all this.
Wow.
So the whole thing was just about, not shaming and, if you eat that half a pie.
It's the dialogue in our head. It's the dialogue that we feel comfortable. We grew up with maybe, critical people or critical parents and we're used to that those voices in our head continue to abuse us by shaming ourselves. Right. And so we're going towards what feels comfortable, which is to be shamed. Yeah. It's interesting.
In myself, I ironically, sometimes I find it easier to avoid food when I'm hungry than when I'm really full and craving. It's an interesting thing. So, I think a lot of fiber, fruit smoothies, things like that can help. I heard of one fella, just an anecdote, what he would do is he made a pact that he wouldn't limit himself on his eating, but he would go for a walk anytime he ate something. And sure enough, the weight started coming off because he would just, and I think before he ever ate something, he says, do I really want to take a walk in the rain right now? I want to think twice about that.
He obviously lived in Florida.
Yeah.
Because do you really want to go walking on the rain? Okay. Right. So yeah, and one of the things that eating also evokes is safety. comfort.
Right.
And, Donna Jackson Nakazawa, she's coming back. She wrote the book, Childhood Disrupted. Great, great, great book. And she's coming up with a new book. She's a researcher, a medical journalist. She's not a doctor. She highlights the study that they did, and I can't remember the name of the study, but they also said that people who are morbidly obese, I'm not saying everybody, but 85%, just because you're morbidly obese doesn't mean this is you, but 85% with the study that they did, they discovered that people who were morbidly obese had been molested as a child. And so, people are carrying this for protection.
Right.
So not only are they shaming themselves, but the body is saying, this is how we're protecting you.
Right. And it's subconscious. They're not even aware of it.
Not even aware. So, that is something that it's so important that we become self-cleaning ovens, that we really look at ourselves and say, why am I eating? I'm not even hungry, and so those are the questions. But, here's the deal with me, Dr. Grable, and you and I have talked about going out to dinner and meeting at a restaurant. We still haven't done it yet, but I will tell you that I will eat clean. I eat well, like 80 to 90% of the time. But when I choose to eat something, I am not going to guilt myself into it.
Good.
I'm going to love it, every morsel. And then the next day, I just won't have anything like that.
Right. And, and if you're going to have something that's really rich and tasty and let it roll around in your mouth. You may find that a couple, 3 bites are enough to satisfy, and then you really don't need any more than that.
Yeah. Well, because of my food allergies, I can't have what most people would consider like pies and cakes and all that. I can't.
Publix has a really good gluten-free cake.
Yeah, no, because it probably has eggs, and there's certain things that I know I react to, not even worth it. But I'll have my chocolate cake or my stuff. But anyway, it is what it is. It's just that everybody has their thing that they can do. Just shaming just causes just worse problems than what it's worth. And we just got to be aware of the conversation in our head. And
something that helps me is if you eat something that you feel badly about or whatever, just say, okay, I'm going to start right now eating better. So maybe even if 5 minutes have gone by and you haven't eaten something, you can give yourself a little psychological pat on the back.
Yep.
You haven't eaten for 5 minutes. You see what I'm saying? And then you just kind of start there, and then you just build, rather than doing one of these beat yourself over the head things.
Yes. Yeah. Okay, so we have a couple of more. I didn't know if you wanted to talk about the couple more, and which or are you good with the list that we came up with, or that you came up with 8?
Yeah, these are kind of real quick. Let's see. Let me back up here. In my
notes. When to seek.
ER
care, which I think that's important.
People always kind of wonder, when should I go to the ER? It's a little bit of common sense, but just a couple of key things. If you have obviously chest pain and you don't know what the cause is, obviously you want to get that checked.
Or if you're confused, you don't even know the date.
Change of mental status, high fever with a stiff neck. That's a warning sign for meningitis. So if you ever,
how do you get meningitis?
Well, a lot of us carry the meningitis bacteria in our nasal passages. So that's the $64 question. Why do some people get it and others don't? So I think it's when you let your resistance get down, and then things can pass on, and then of course, unexplained severe abdominal pain. So most of this stuff's pretty common sense.
Yeah. But some people, because that could be a kidney stone as well, right?
Right. Yeah. And even with that, if you get hydrated with an IV, that can help you feel better and pass it.
Okay. Anything else?
And then the last one, I just had a few thoughts about indigestion, because we're all going to get some of that. Mm-hmm. So one thing that people can have is, the reflux problem.
Mm-hmm.
And I think we've talked about, celery juice before.
Mm-hmm.
Fresh squeezed celery juice, that can help your stomach to make hydrochloric acid. That can help to reduce reflux problems that people can have. There are the food allergens. The big six are milk, wheat, yeast, corn, soy, and eggs, because those are in everything. So that's why we tend to get and that can often cause indigestion, reflux, that kind of stuff.
Yeah.
And then fatty food intolerance, oftentimes that's kind of a little gallbladder signal, if you have trouble with fatty foods. But mastic gum, zinc carnosine, those are a couple of natural things that can kind of help soothe.
Chia seeds are good too.
Chia seeds, yeah.
Yeah, because they absorb.
Yes.
So they absorb the acid, but don't eat too many. I got addicted I was making chia pudding for breakfast.
Yeah.
And I think I overdid it. And I think I kind of like I underproduced acid. So I was like, oh, could that be a reason that you have that acid reflux? It's really not too much acid. It's very little acid, and it's not digesting your food.
Right. It comes back up on you. Yeah.
Yeah, I think that's what
happened. The
pH
to your stomach should be about 2, which is very, very acidic.
Yeah, and I think I overdid it with the chia pudding.
Yeah.
I need to come up with something else
to a gallon. Yeah, don't know above that. So.
Gallon. I was having it for breakfast. I made the chia pudding batch, and then I'd add blueberries and bananas and all this other stuff. And it was so delicious, and it was quick, you just eat it real quick. And
start to sprout at all or not?
I started singing the chia song. Yeah, I started getting a little green. Yeah, started getting a little green. But that was, yeah. So we have to be aware that even good foods and too much excess, it can be bad for us as well.
Correct.
Or seeds. Yes. Okay, Dr. Grable, anything else that you would like to share your wisdom for this 2019 going into 2020? Give people clarity, that 2020 clarity.
I think just work towards eating a plant-based diet. That's probably one of the biggest things, that I would encourage people to do. And, just remain joyful. That's the key.
Gratitude.
Gratitude in all things. Be thankful.
Yeah. I always say things could always be worse. So be grateful for what you have.
This is true.
I learned that at 10, by the way.
Oh, wow.
Yeah. Ripe old age of 10. A priest said in the homily, some people get upset because they don't have any shoes to wear, or their shoes have a hole in it or whatever. They don't match their purse. But there are people who just don't have any feet.
Right.
And that, I don't remember what else he said after that. I just remember that, in all things give thanks. And it may not be at that moment, but knowing that things could be worse can immediately bring you to gratitude that it's not.
Exactly.
Yeah. So Dr. Grable, thank you so much for everything that you do, taking the time out of your busy schedule to share your love and your wisdom and your knowledge. And, I love how detailed you are, because you want us to understand that it's not one size fits all. There are multiple reasons why we might be doing something. And, I know that next time you come on, we're going to talk about, men's health and continue on. So we're going to talk about the prostate. We're going to talk some more about the hormones, and there's so much that you have ready to share. But most importantly, Dr. Grable, I love how you combine the spirit, the mind, and the body. One size does not fit all, and you do an outstanding, phenomenal job at making sure that pain isn't due to past trauma, or isn't due to past oyster that has botulism or whatever it is.
Yeah.
But you are very good at that. Thank you so much for being a wonderful, not only MD, but medical detective for all of us to take our life back. And thank you so much for being a sponsor of the classroom.
Oh, thank you.
Yes.
Okay.
And so to all of you, I want to say thank you for watching today. Please share this video with your friends. Let them know that there is a way that you can be healthy and the must-dos to be aware and prepared for the best year ever. So thank you so much for watching, and we'll see you next time on Facebook and YouTube at whenyouneedafriend.com. So let me go bye-bye. Say bye-bye.
Good night.
Say bye.
Bye.